Swayam Prabha. Digital India. Educated India.
Hello friends, welcome back to this NPTEL course on education for sustainable development. So, in the last class we are discussing about education ESD for sustainable healthcare, and we have already discussed up to how to build an health grid, how to build the health grid and what is the health grid, that is. So, we will continue with that concept. So, this is the formal architecture of an health grid, global public health grid. So, as we have already discussed, health grid means it is a kind of network system which not only coordinates with all kinds of the providers, consumers, organizations and ministry, etc., but also it delivers the services, delivers the different kinds of services. So, that means it is a kind of holistic approach to develop the network model like to coordinate, collaborate and provide the services to all the consumers. So, here we can say that how the network between global organizations, those who are already working on health, that is WHO, UNESCO and other kind of things, then other agencies like the universities, resource organizations, all the other NGOs also working on this. Then health ministry of the countries, that both at the central level, local, regional level, etc. Then health providers, those are the private organizations, private hospitals, the clinics and other kinds of consultancy services, the healthcare providers, and at the end the consumers. So, consumers like the individual consumers, then the consumer organizations and others like corporate other group or team stakeholders, all kinds of. So, this is the network between these, you can say these 5 domains, the network has been built, and in between and within this network model, then all kinds of services and database are being provided. So, all kinds of services as well as the database network system has been provided in this, where not only you can get the all kinds of the medical data information, but also all information regarding the doctor services available, all kinds of analysis of the fast viewers data, case studies, and you can find out, you can explore anything to search the any kind of data and services. So, this is the kind of model that is called the global public health grid. So, for our country also this kind of grid must be there in our Ministry of Health, etc. Ministry of Health, both in the central government as well as in the state government. So, this actually helps in coordinating and collaborating and taking the quick action when any kind of emergency takes place. So, National Digital Health Mission, that NHP 2020 we have already discussed about this. So, it is again it is the same kind, it is also based in that similar pattern of national health grid kind of. So, it is an integrated nationwide database of health service providers. So, this digital health mission is actually nationwide database for the health service providers, and not only it includes the care and patient consent management, etc., but it has an open application framework, API framework. So, here all the integration of the available data are available regarding the healthcare data processing, and primarily it has been done through the digital platform, that is cloud based technology, IoT, Internet of Things for medical data healthcare, and then all kinds of healthcare innovations, healthcare strategies. So, it is based on primarily on AI, cloud based technology ecosystem and IoT. So, all these data has been integrated and made available to all kinds of stakeholders in the health platform. So, here the mission is to create a management mechanism to process the digital health data and facilities in its seamless exchange. So, that all the available data will be there in the digital platform. So, the mechanism can be management mechanism will be has been adopted there. So, that is not the seamless processing of all kinds of digital data, health data, etc., but seamless service also promptly, whichever whoever wants to know everything and or have the data or search for any kind of thing. So, for consultancy, for clinical decision making, for any kind of medicine, especially telemedicine. So, that can be promptly procured from the database. So, that is why it's a kind of digital platform digital platform consisting of all kinds of health data, digital health data, including all kinds of services, medicines, agencies, doctors, nursing staff, every kind, all details A to Z. So, it is, we can say again, but again this National Health Mission or the health grid, it should be evidence based, means case studies, some of the case studies are there, some of the operation cases are also there, some of the so it must be very transparent, it must be very efficient, and it must be based on evidence. So, evidence based. So, all the data are based on evidences and cases, and it's very transparent. It can be given, provided on demand with a seamless service, and it's very efficient for all future transactions, all future activities for the health ministry as well as the private hospitals. So, now this COVID scenario actually it has given us it's a kind of emerging challenge. It has made us it has compelled us to face a kind of disaster, because it's in that chaotic situation. Not only we are falling short of the hospital beds, oxygen supply, and the special bed, at least beds for the COVID-19 patients. So, it's actually created a kind of chaos. So, not only it has created the chaos, but it has also taught us the lessons. So, on the basis of this case study, that is done by Gautam et al. In 2021, it is found that the COVID-19 has placed an extra burden. So, extra burden over already overstressed healthcare system, healthcare infrastructure, whatever existing healthcare infrastructure we are having. Now, it actually not only in terms of staff, in terms of doctors, in terms of hospital beds, in terms of facilities, in terms of equipments, oxygen supply, medicine, all kinds of things, it has created havoc. It has created actually havoc and overstressed this healthcare infrastructure in our country. So, at the same time, it also taught us a lesson. So, now here you can see this is the data about the COVID-19 patients, and this kind of all kinds of sanitization. That means health workers, they have been exhausted, over exhausted like anything. And these are the scenario, you can say, when the migrant workers, they were leaving the places from the Gujarat and some other places where they used to work, and they are moving towards, and that and for them the communication services, transport services were not sufficient. So, how they were traveling by walking, simply walking, and how many deaths have been done, and how to put them in the quarantine. It was a very difficult phase that India has already faced since 2020 to 2021, mid 2021. So, these kind of things actually it gives us a clear picture of how important is the health infrastructure, how important is the health system. So, how we can be with the digital platform, how we can update ourselves so that we can be better prepared for our future. So, here the implications, like all these COVID-19 cases has the implications, like all the Anganwadis. Government has already implemented the Anganwadis, Pradhan Mantri Matru Bandhana, that is Mother Maternal Care Yojana, then integrated ICDS schemes, then Poshan, that is food security or Poshan Abhijan, etc., planned coordination. But again, a better and effective coordination, planned coordination among all the ministries, states, center, and different organizations working on this. It would be very, very important for us to move forward. So, realistic database also, that means the realistic database, not the fake, but the realistic database of the population, those who are already suffering from the nutritional deficiency or health, that means our related, and the health infrastructure available in the rural areas, health related services, the exact picture of health related services, the shortcomings, the gaps, Yeah, so this should be taken into consideration in all segments of the society, in all corners of our country. So these are some of the clips how that means. Then again, from time to time we have to educate our rural people, so that education and awareness program is very important, not only the situations like in the situations like COVID-19, but also in general. So the people must be, our citizen must be made aware of how to take care of their own health, how to take the responsibility of our own health, what are the basic healthcare amenities available, service available, and the food habits and the balanced diet and cleanliness, safe drinking water, food security, water security, and all kinds of things, hygienic things, all these things should be educated from time to time. So education and training and awareness program, again that also it is again another domain, important domain of healthcare system. Not just service providing the services and infrastructure, but communication, information and education through different kinds of workshops, awareness program is a very important factor domain. So from time to time, not only the medical staff but others should also be trained from time to time, and through that means it's a kind should be a kind way like that means supply chain kind of thing, from the center to the state to the regional to the block level, panchayat level, all kinds of. So this is the kind of from that means from center to grassroots level kind of things. So it should be at every step it should be that means at every step there the vertical should include all the stakeholders at every level, starting from the center to the grassroots level, the village level. So all these things, that means how to address the dimensions of health, especially the physical health, mental health, social health, community health. So and how to what should be the percentage of the investment in the health sector, how to, that means and monitoring and evaluation of our the works being done. So distribution of the benefits, services, resources. So enacting again say active and inclusive engagement of the grassroots level workers, grassroots level people at the panchayat level. That is, it is very important to involve them, engage them in the health services being provided at different level. Even though the education, communication and information comes from the central base, from the center, while it is being disseminated, while it is being circulated, communicated, then at every step there is the trainers should be there, the leaders, the panchayat leaders should be there to take care of this, or to take forward, or to follow up, or to monitor this kind of processes. So these are the some of the YouTube links that you can go through for the detail discussion, detail analysis. So now let us look at the Indian picture. Like this is the typical rural picture in our country. So here overall help of the community people should be sought for providing health care to all, because the program can be successful without because no program can be successful without active involvement of the community. So how to engage these stakeholders, villagers and the panchayat level, all the people, because through this organizing this kind of workshops, this kind of awareness camp, this kind of community level health programs, like not only is not just about the blood donation camp or the eye checkup or the general health checkup, but also awareness and communication. So continuously this continuous awareness, information dissemination, then media, use of the media, that means through multiple media channels, circulating the information, engaging. So then just to, my first thing is that through in education, information, communication, we have to remind them this that how crucial, how important this is, and to remind them, and to, that means again and again, so that they will be alert. So to create that alertness, then after creating that alertness, how to again actually clarify their doubts and how to educate them through this kind of rigorous workshop and etc. So for this another, that means for education and ESD and all kind of things, another setup, that's another setup of people are there who are for publicity, who are for advocacy, who are for counseling, who are for communication, who are for all kinds of that means you can say queries, all kinds of analysis of the first FAQs, or analyzing the questions, queries, doubts, and all kinds of the information. That means they are seeking, the patients they are seeking for different kinds of disease services, doctor, etc., all kinds, A to Z. So that is, and again that is that information education and ESD cell, that is a very important, it's a big, it's a most important dimension, it's most important component of our health grid, because only through sharing the information, disseminating the information, we can energize, we can engage our citizens, because as you know, most of our people, they are staying in the rural areas, remote areas. So, and how to bring them to the mainstream, how to that means how to provide them the access, to have the access to good quality health services, good quality health care services, and with the affordable cost. That is the biggest challenge for the National Health Mission. So, again here we can say, along with this health grid, we can also introduce a sustainable quality improvement. This is again another strategy, that is sustainable quality improvement, that is it's an again continuous ongoing systematic effort to improve the patient care outcomes. So, and the systems performance. So, even though we have developed this health grid and the important domains under it, including the information and communication and media, etc., but at the same time quality improvement. In every organization, when we talk about the quality check, quality improvement, similarly the sustainable quality improvement should also be an important part. So, here that means it is based primarily on the practical framework, where again we provide the important aspects like ecological sustainability, that is the primary thing that we have already discussed. Adding social value, how it has a positive impact on the society, that is the adding social value, how with increasing time, with increasing experience, with increasing days, how it adds value, social value, and its long term perspective, that is for the future. For the future, its perspective, the sustainable for the sustainable applications, implication in future. So, this sustainable QI, quality improvement program, it has primarily 4 stages. It is based on the 4 stages, that is that means taking into 3 dimensions, taking into account the ecological sustainability, then your social impact, adding social values, and the long term perspective in terms of cost effectiveness and technology and services, everything. So, here we have to go through in the 4 stages. First thing is to setting the goals. Setting the goals, primarily it includes minimizing the waste management, minimizing the waste in how to collect the waste and how to process that waste, so that it does not affect the ecosystem, that is again waste management, recycling of the this waste products from the hospital, from the healthcare institutes. This is the biggest challenge, and the complete process of recycling should be a very important factor. Then institution waste segregation system, as the recycling, everything, that is the setting, that is the major first thing. Then comes to the then we have to study the system, and every system, every node, every joint, every point, there should be a feedback mechanism. There should be monitoring and evaluation thing, and the feedback mechanism from the feedbacks from all kinds of the stakeholders. Then we have to focus on design and improvement effort, that after getting the feedback, after evaluating the the effectiveness and efficiency, then we have to improve at every point. We have to improve it, improve and make effort to improve it in terms of quality, in terms of service, in terms of financial costs also. So, then thereafter again from time to time, it is like just mapping our health services from time to time. So, thereafter and from time to time, maybe quarterly, maybe half yearly. So, we have to measure its impact also. Suppose we have adopted a new strategy, and we have introduced some kind of new measures for the quality improvement in sustainable health care. So, then we have to again measure it, map it from time to time. So, here again therefore, the key difference here is that the patient empowerment, self care, lean services, and low carbon alternatives, all these are the crucial issues. Now, recently I can give an example of that is in Bhubaneswar, that is Swayam hospital was there. But after the CEO, after another CEO has taken up, Dr. S. Das, Dasha Mr. some lady has taken over the charge of this hospital, and she is from the psychology background, and she did her research only patient care system, and she has completely renovated the whole system, health system of that hospital, and it has been named as the it has been renamed as ultimate care, something like that, with a new face, new look and new system. So, this kind of, so it primarily also depends on the leadership, So, we mostly the professionals, actually hospital management, they give focus more on medicine, more on doctor, more on staffs, etc. kind of thing, but they, that means they miss of often so many critical and crucial things like the patient care system. Patient care, not only the OT facilities and etc., patient care, that means especially in the interpersonal, that interpersonal communication, care, care and service providing to not only the patient, but to their caretakers as well. So, they, because they, they from time to time they need to be communicated, updated regarding the updated about their patient's health, etc. So, that communication, rapport building, that concern, that empathy, that social, that means social, you can say social relationship, that is also very important factor, because it is a major factor, is an emotional factor, it's emotional attributes. So, so along with our all kinds of professional things, as well as the facilities like infrastructure, all kinds of things, even then so this emotional component, this service, that is service which is primarily based on emotional bonding, interpersonal relations, is very important. So, along with these concepts like minimizing the carbon footprint, then that means all kinds of the that means recycling process, ecological thing, measuring all kinds of impact, environmental impact, social values, social impact, and economical impact, also economical, financial cost, effectiveness, everything. But at the same time, this is the emotional aspect of this healthcare service is very important. And the hospitals, those who actually, the doctors, they care, nurses, they take care, and they establish, they are very much concerned about the social relationship, interpersonal relationship, and being empathetic and give that kind of emotional support not only to the patient, but to the caretakers of the patients. So, these kind of hospitals are, these can they become gradually very much top rated and preferred, and become popular by the stakeholders and the patients. So, here we should not ignore that emotional aspect, behavioral aspect, affective aspect, care, patient care aspect, and this communication, and from time to time they should be updated. And for this especially for the service orientation, communication, care, and this kind of emotional bonding, all the staff starting from the doctors and to the nurses, they should be updated, they should be trained, they should be trained for this kind of soft skills and the leadership qualities, and the especially soft skills for handling, communicating, and for appraising them, updating them with an empathetic attitude, that is the most important thing. So, however, we also commonly see not only the carbon footprint, etc., as reported, that means the major factor of this quality index, improvement index, which is much more easier to quantifiable, to quantify it, and primarily the focus is more on the climate crisis and the pollution and the environmental things. But at the same time, I would prefer that we have to focus more on the social value, that is the very biggest thing, even though it doesn't appear to be very important, etc., but actually we are missing the nuances of this healthcare system. It's primarily based now, even though we spend lot of money, we invest lot of money, we procure in equipments and highly professional doctors, etc., but the nerve center is the nervous system of this healthcare system is that affective domain, emotional bonding, that is the social system, social rapport building, all kinds of. So, we should take care of this, is a very crucial, very critical issue. So, you can go through these, some of the literatures are available, some of the YouTube links are also there, you can go through it. So, that we have whatever we are discussing about efficiency and effectiveness of healthcare provisions are also. So, how to enhance the efficiency and effectiveness healthcare provision through the different, we can also adopt some of the community or home based models are already available. And are already available, but again it can be enhanced with the technology, new scientific discovery, engagement, etc. So, again availability of the well trained health workers, care workers, and their training and development from time to time they have to, and for the especially for the communication, education and awareness, the units should be very strong, robust and updated. So, cost and economic benefits also important, and health and resilience of the population again besides the treating that diseases, communicable and non-communicable diseases, but how to strengthen the health, general health system, health of the population through how to enhance the resilience, how to strengthen their health conditions, that can also be the, especially the children's health and the maternal health. So, ministries would also provide some kinds of medicines, nutritionals, supplements, these Anganwadis, these midday meal schemes and the ICTS schemes, they used to do it, even UNICEF also is doing it, but during this lockdown period it has been affected like anything. So, that is that it has to how to recover it, how to, so we must have another opening, another platform or avenue. So, that means even in the situation of the disasters and pandemics or kind of any natural disaster, how to then what are the alternate solutions, what are the alternate channels through which these health supplements can be provided to them. So, even for the private caregivers are also the informal, like those nurses, that means the private nurses and the NGOs, those who are having the informal networks, who actually they are not even though they are not certified, but all the time the workers are not certified, but they also informally they also provide this kind of private caregivers for the senior citizens, especially in the cities and the towns. So, all these are the different aspects of this quality improvement, sustainable quality improvement parameters. So, now I want to stop it here. Now, in the next class that then we will continue with other kind of aspects of the quality improvement, sustainable quality improvement. Thank you.